Fantastic. So for those of you that haven't read the agenda, we've got how to have conversations about sustainability, how to get an agenda out, communicate with organizations and their staff, including training for staff to develop climate literacy. This is a big old topic. We've got Peter, we've got Toby, who are both members of the Greener Care Special Interest Group. I'm going to give them a little bit of a hand as well. And if anybody would like to join in with this, do please raise your virtual hand and we'll get you on screen as well. Jade will keep a lookout for that. Okay. So chaps, where to start really? Let's start with this. Well, let's assess. Are we any good at even starting conversations in organizations about greener sustainability? Because I suspect in most NHS and social care organizations at the moment, even starting a conversation on this, you're going to get rolled eyes and you're going to get, don't you think we've got more important things to talk about? So how do we get the topic even at the top of a priority list these days? I'd invite either of you to have a bash at that first question.
I start off.
Go on, Peter.
Right. If I say this morning, I went to a school where I'm a school governor to talk to the sustainability environmental group and to listen to their plans there at the school. Last night, I went to a Lunar Society lecture where a professor from Birmingham City University, whose name I've now gone blank on, but has just produced a book at £160 for the hardback, looking at the Birmingham Park plan, but she's a landscape designer and very much into climate change. We have within my Lunar Society a climate change group. So from my point of view, there seems to be no difficulty in talking about it. And I noticed the Greener Place plan for Birmingham City Council was actually published in 2017. So to me, one of the problems is rapidly becoming who isn't talking about it, and how do I actually keep a finger of what's going on? And I suppose the start for me, as the group knows, was in my Rotary Club, which has formed a working group on climate change. And so I came into the group saying I don't know anything about it. Now I'm already beginning to get a bookshelf full of material. So to me, part of the challenge is actually trying to map across all these various sources of action to see where there, and I'd go back to what you said in Devon, is the need to be sure that everybody is roughly on the same hymn sheet and whose priorities can practically go ahead together.
All right, thank you, Peter. That's a nice start. So Toby, there's no problem. Everybody's talking about it already. All the other stuff that's going on that's tempting to take priority, actually, it's not.
I think there is, and I've been kind of really pleasantly surprised by how quickly this has made it into people's conversations. But I think the challenge that we have is making people kind of go from, I think all of us on the call here are all on the call because we have at least a personal interest in environment, in making something greener. How do you bring that into work? So I work in a very different environment. I work in quite heavy industry, but I work for a Swedish-owned company, and the Nordic regions benefit from some beautiful countryside, and in their personal lives are pressured quite a lot by their government to do things personally to be greener. So it's about that transition, I think, between actually how many people within your healthcare organisation or your social care organisation have started doing something greener themselves off their own bat, driving a hybrid car or doing vegan Monday or whatever it is, and getting them to actually realise that they shouldn't just leave that at home, that actually there is a transition to be made. And for me, it comes back to a really important point that Darren made earlier on, is around agreeing a purpose for this and for your organisation. So why would your organisation become sustainable? Why would it be attempting to become greener? For me, I think a lot of people talk about kind of pandas and polar bears and things, but to me, it's patients. We can't treat patients the way that we treat them today forever. We treat them with non-renewable resources. So eventually there's going to be no more treatment left. So unless we change that, we're not going to be able to look after our patients forever. And if you get your teams talking in that kind of a way, you'll find that I think their engagement does leap up quite a lot, and they realize that there is a professional responsibility as well as a personal one.
I think that's it. That's a great observation, Toby. Thank you. Look, one of the things that strikes me is if things aren't measured, then they don't get done. And I'm looking at this delivering a net zero NHS by 2040. Right now, honestly, hand on heart, I don't know where we are against that. I don't know what the current live data is in regard net zero for the NHS and social care. I don't even know where we started at in terms of what's our current figure. You know, and it strikes me that one of the issues that we all have to confront in our different NHS and social care organisations is, where are we now? Because if we know where we are now, people can kind of get enthusiastic about plotting a route to improvement, but without that measurable opportunity, isn't it really difficult to get people excited about it?
Ooh.
Peter, your thoughts?
Well, I think plenty of people excited. The Birmingham Community Trust has a green plan and has a monthly update as to where we are on the plan.
But that, if you don't mind me just interrupting you, Peter, that would be presumably against objective actions that you've said you're going to engage in. What I'm saying is, where's the data that underpins this stuff that people can look at and say, yes, we're making progress, or no, we're not?
The trust data, I have to say I'm not sure about, and I'd have to go and look. There is quite a lot of financial planning going on, looking at costs and benefits. And of course, one of the imponderables that's hit us all in the last few weeks, both personally and organisationally, is energy cost. And what we've rapidly realised is that we're not moving fast enough in changing sources and reducing unit cost in this industry. We did have a talk, didn't we, from one of the family who's leading on heat exchange systems. And I'm glad to note that the government is going to cut the VAT and reduce the cost of those. So my impression, certainly from Birmingham Trusts, is a lot of them are still using non-green energy sources, lighting, insulation, and all those things. And in fact, the school, I found out in April, is going to do, or the King Edward's Foundation, which is 10% of schools in Birmingham, is going to do a full energy audit.
Well, so now we're talking. Now here's the nice bit. You see, I'm so glad you ended with that. I'm going to come to Toby in a second. If we don't audit where we're at, it's really difficult to get a cohesive, coherent, convincing plan about where we're trying to get to. Yeah. Because everybody can fudge it otherwise. And it's this audit process that my personal view here, it's the piece it's too opaque. There's not enough certainty to it, and it holds back intelligent conversations about what we do next. Toby, your thoughts in that regard?
Yep, you can make audits as opaque and complicated and frustrating as you want. And particularly, I think climate scientists are like many groups of scientists, very fond of their own vernacular and their own way of calculating things, and rather than speaking in plain English. So it's important to understand actually what you're looking for. To me, the simplest way that you can start, and it isn't comprehensive, but you think that if we're looking at our emissions, one of the sources of emissions that we have is our energy use, as Peter mentioned. If you want to look at your energy use, you don't need to do an audit first. First of all, you need to just start looking at your utility bill. And if you can get your utility bill broken down into quarters or months, that's a good starting point. It isn't comprehensive and you can add to it, but step one, start there. Okay, have we used more energy or less energy than last year?
And that's not cost, that's units, just to be clear, yeah?
Yes, yeah, absolutely. So on any utility bill, you will see a lot of people ignore it on their domestic ones, but it is always there, it has to be, that you have figures in both kilowatt hours, which is units of energy, as well as money. So you will be able to see that, and you will be able to see what you're consuming by different energy sources as well. So Peter mentioned renewable energy as well. If you're buying partly renewable energy or wholly renewable energy from your energy supplier, that'll also be reflected. You'll be able to see how many units of energy in kilowatt hours you're buying in different sources. So you can do that purely based off data that you've already got. If you want to then take the next step into auditing and starting to look at actually all of the other gases and sources of energy you use, transport, etc., yes, that is a bigger job, but we could start somewhere relatively quickly.
No, that's a great response, Toby. Thank you very much. Peter, did you want to add to that at all?
Well, we've just completed a 3-month Octopus energy audit, which was encouraging customers to cut their energy use, electricity and gas. And I'm in the top 10% who managed to reduce, any very energy inefficient house at the moment. So clearly, if this is done in partnership with the energy production companies, and as Toby said, we all get bills from them for across all the commodities, including water, electricity, gas, oil, and so on. It is feasible, going back again to what Toby said about we start with ourselves, beginning to see where you are. We've all by now been told how much our bills are going to go up from tomorrow, isn't it? And next October. So there shouldn't be any difficulty in Trust and other organisations doing exactly the same thing, should there?
All right, so that's energy. So Toby's been very helpful there, looking at kilowatt hours, for example, from an energy perspective, and breaking it down then into renewable energy versus non-renewable energy. What else could we reasonably look at if we're trying to get a conversation going about sustainability and carbon reduction? Are there any other, what you might call big ticket items that we should be addressing in terms of a benchmark for where are we trying to go from to?
Well, vehicles, travelling. I've been very good. I've got my electric car last year when it was the cheapest on the market, but failed the witch safety test.
All right, but just joking aside for a moment. So when we're talking about vehicle, is that to do with emissions, or is it to do with fuel, or is it a bit of both? Can we construct something whereby, from an organisational perspective, like the ICS for Devon, for example, they could merge all of their vehicle data together and look at that and make a planned commitment to reduce emissions over a particular period of time, reduce expenditure on non-renewables over a particular period of time? That strikes me as a doable element, but again, you've got to have that, where are we now?
Yeah, and I think that, you can convert it into emissions, and there are publicly available emissions table that tells you for, running a big diesel fuel truck is X kilos of CO2 a mile, whereas running an electric car like Peter's, it is a lot less CO2 per mile. So you can convert it. But again, the main first point is to look at, okay, do you know what all your vehicles are? And do you know how many miles they do per month?
Mm.
Because before you start kind of changing fuel types or anything else, let's actually have a look at how big your problem is. An organisation the size of Devon ICS has got a much bigger problem than many of the London ICSs, for example, because just geographically there aren't as many miles in a London ICS. So you will probably find that their impact is much lower. So maybe depending on your ICS and the region that it's in, it might be more valuable to do that or less valuable to do that. But until you actually add up how many vehicles you've got and how many miles they're doing, you don't know how big a problem you've got. So that's a good first step to do.
And
Well,
like Birmingham,
sorry, go on, Peter.
Birmingham local authority are saying, like London, a number of cities have now got zero emission zones, and did a lot of work in collecting data on how many vehicles go through, what proportion of them will have to pay a charge if they go through the zero zone, what proportion are not going to pay a charge, which isn't just electricity. They've got at the moment an emission level below which people can still go through the zone. So I'd say for that, Birmingham has got a lot of data, and again, the trusts and the ICS are looking at combining the fleets, looking at the cost of change, and such like. So I think that potentially is an easy win, and hopefully we'll all, including older people like myself, will learn to change from vehicles anyway to nice, maybe battery for me, but cycling and such like.
Yeah, we absolutely get it. I'm focusing on the practicalities of where do you start if you're trying to do a benchmarking audit exercise for your organization of whatever size it is. You know, we will have people on this call or watching the recordings who may be a manager of a relatively small 15-bed care home, for example.
Mm-hmm.
You know, or maybe we've got a domiciliary service, you know, and they've got a dozen domiciliary care nurses who are going out on a daily basis around their region. You know, they're wanting the same kind of practical guidance and advice as the huge, you know, Derriford Hospital in Plymouth, because if we don't all start at the same point in respect of what are we trying to measure, you can be certain that we'll all arrive at different kind of success criteria, and that strikes me as entirely counterproductive. Elaine, could I just bring you in? Do you mind very, very quickly if we just bring you in here? You've looked at measurement and audit and so on. I know you've done it to a great degree. Are we missing any tricks here in terms of what we've already discussed?
No, but it is hard, John. And I think it's almost a new science, as Toby was alluding to, that we need to try and make some sense of. I've put in the chat that there are a couple of examples there that all NHS organisations now are being asked to, as part of the Greener NHS initiative, to calculate their own carbon footprint. So there should be a baseline, John, for organisations. So I think we have got a place where we know where we're starting from. What's been quite tricky is how you calculate that, because I'm not an expert in any way, shape or form, but it took me a while to understand what carbon equivalents were and why we use that as a measure, because different gases decay at different times and they have different impacts on the environment. So when you see people like anaesthetists who really have grabbed hold of this and said, oh wow, our clinical practice, and I know this is just a very small part of a small area of healthcare, but the anaesthetists recognise that actually their practice and some of the gases they were using were having such a significant impact compared to others that they could do, that they were driven to measure it, themselves. And so they started to become very carbon literate because it was very important to them. And then they, as you were quite rightly saying, could build the case to say, if we move from this to this, then this is the likely impact. So I think it's quite a new science. I think there are tools, there are organisations that are very skilled in this and are helping people in the NHS, mainly in estates, I have to say, at the moment, where this seems to focus on the energy is probably the first place we're going to. But I can see, and I'm very keen, as you know, to try and bring a measure for anything to do with the environment into any part of the work that we do, improving health and social care.
Thank you, Elaine. And Lorna has put up one of those carbon footprint measurement tools as well. So thank you, Lorna, for that. We're going to hear from Janet Smith later on from the Royal Wolverhampton, who's going to be talking to us. And I bet Janet's got some measurement criteria that they've used in Wolverhampton. She's nodding away. And we've got Jamie Gow from Williams Medical, one of the biggest primary care distributor, who's going to be talking about efforts that they're making. So there's stuff to be learned from everybody here. Let me come back to Peter now. Training for staff in respect of climate literacy, Peter. Any thoughts there in terms of where we might begin that? Because, I mean, I loved the idea earlier on of doing an appraisal system which includes individual actions and so on. But even to do that, there has to be a degree of environmental literacy to help people understand what we mean by those sorts of actions, I guess. Any thoughts?
Yes, certainly within, again, a community trust, the green plan involves individual actions. There are multiple training days, and there are across most of the places that I've come across. And last night we were talking about ICS use of the word place and how actually you influence the whole environment. But I think the message very clearly for me from our trust is it is everybody's problem and everybody's duty.
Yeah, and the last thing any of us want, I suspect, is to create this kind of environmental training, greener care, sort of training jamboree for training providers who all create these courses of varying degrees of excellence. And it just becomes a money-making exercise that actually doesn't take us anywhere. I mean, Toby, my view of this is always, do not take individual people as idiots. Most people in this country know perfectly well what we mean by environmental sustainability and greener care. And most of them have got some kind of a personal commitment to try to do their bit. The key to success, therefore, is to create environments in which people can come together and discuss what they're doing and what they could do. Do you think that's fair?
Yeah, absolutely. It's certainly an approach we're taking within our own organisation, where there is quite a mixture, I think, as Darren put it, quite a mixed ability group in terms of climate literacy. You have people within our research and development teams who are very, very scientific and immediately dived into probably the contents of Peter's bookshelf to educate themselves as soon as this topic came up, and can now reel off, days worth of jargon and things. But then you have other people who are more people centric and perhaps don't enjoy reading the huge, great, detailed technical manuals. And not everybody will learn that way. We roll out a certain amount of mandatory sustainability training, and our CEO is very insistent and very kind of public about the fact that it is mandatory for a very good reason, and he takes it himself. But then after that, having used a bit of basic training to establish a bit of common language around things like Elaine mentioned, carbon equivalents, and why we would use that, a few terms like that, actually the best thing to do is to establish discussion groups. So we have discussion groups within our different business areas and within our different regions that meet and talk about their problems, we do have a little struggle, and there is a little bit of a watch out around stopping them then taking independent action that might run contra to what the wider organisation is doing. But in terms of actually generating ideas and getting ideas discussed and getting the general level of literacy up, I think that sort of discussion group model and how that works is very successful.
Good. Okay. Well, I've got half an eye on the time. We've got about 10 minutes before this session is scheduled to finish. Would anybody from the audience like to throw in any observations, opinions, or comments at this stage? Do feel free to do so. You can unmute as well. Don't worry about it. Just come on in.
Hi.
Hello. Who's that?
It's Janet.
Hello, Janet. Forgive me. I can't necessarily see. I can only see the spotlighted folks. Here's Janet. Hello, Janet.
Hi. I just thought I'll add a bit more in terms of the carbon footprinting. Both Toby and Peter got a really good points in there and very practical ways of looking at it. But in terms of the NHS, really, majority of our carbon footprint actually comes from procurement and what we call scope 3. So procurement, which includes capital, includes third party services that we actually contract out. That includes it. But unfortunately, with scope 3, there's really nothing yet in the market, I would say in the market, that could comprehensively measure that. So it's quite, that's where the challenge is. In terms of scope 1, which includes energy and travel, like grey fleets, business mileage, etc., that's quite, there is already an established way to measure them, and also scope 2, but scope 3 is still very much, you know, something that no one really has managed to put something together to measure, and that's where the challenge is.
All right, thank you, Janet. Go on, Peter. Yes, you got a comment?
I'm just thinking back to the meeting I had this morning and the way this school is developing its sustainability and zero net carbon program. So the first thing I saw was they've just produced a video for the whole school, and I think probably for the whole of the foundation, on the basics of what is sustainability, what is net carbon. They've developing a number of projects, of which maybe the most unusual one, I think, is a business plan to turn plastic into plastic sheets, which can then be used for other purposes within the school, including packaging, insulation, and so on. So they're doing this with the whole school, but also with litter picking outside. And we haven't mentioned that, but of course there is a lot of community action going on, especially with plastics, in trying to reduce the plastic burden that this planet seems to engage in. They think they will financially repay the costs of this commercial machine within 12 months for that. They're looking at e-waste. Nobody's mentioned that actually in the health sector that I've come across, on a project they're calling Dump. So talked a bit about rare metals. Maybe they can make a fortune.
Sorry to interrupt you, Peter, because I'm just conscious of the time here. So for all of those things that you've mentioned, and they sound fantastic, has the school managed to input a benchmark measurement criteria about where do we start from? Or are these just, I say just, that's not fair, or are these well-intentioned, perfectly sensible and good things that they're going to do because they're good things to do?
They're a mixture. I mean, the fact the whole foundation's taken up the energy audit is, as Elaine said earlier, this is where we are now.
Gotcha.
And there have already been some audits of the cost of where we would like to be, as there has, of course, in the hospital sector for a long time. My nephew's been looking at low carbon boilers and heating systems, again, going back to energy, within many of the acute trusts across the country. So I think, Elaine, again, you said there is a lot of audit going on, and we are building up quite a big database. But it's back to Toby, and I think back to something you said, John, in one of our meetings, is what is the practical way of achieving scale across the system? And that's can be certainly the last night I was talking about across the whole of the West Midlands. One idea was to join the Mersey and the Severn together, but
let's not go off down that particular rabbit hole. All right, look, that's fine. I think what we'll do is, first of all, I'm going to thank Toby and Peter for their time on this particular session. And Elaine, thank you for coming in and lending a hand as well. I'm going to move on to the next phase, I think,